tell me about your symptoms before our surgery.
Before the surgery that I had done in December,
5 months ago.
Severe right leg pain for approximately a year, maybe a little bit more than a year.
1 to 10, how bad was that pain?
The pain was 9 to 10.
9 to 10.
As a general.
Can you explain where that pain was?
It was my whole right leg would just hurt, behind and front. Just a terrible pain.
Yeah.
I was taking at least 6 extra strength Tylenol a day, a Vicodin some days. I was, and then taking some days 2 to 3 OLLIF with those 6 extra strength Tylenol.
So, how is that pain now?
The pain is gone in my leg completely.
When did that pain go away?
The pain went away, well, right after surgery, I noticed the pain was gone. And then through the last 5 months, periodically, I might get a little leg pain, but it goes away immediately.
Yeah. Does it depend on kind of activity you do, or?
It could.
Yeah.
I guess I kind of I would notice it maybe if I did a little, but it went away right away.
Yeah, but that is no comparison to what it was before.
Oh, no.
Okay. How's the back pain?
The back pain, I didn't have a lot of back pain before surgery. Originally after this surgery now, I noticed when I traveled, it caused a little bit more pain, which I didn't do a lot of traveling. And it's more of an ache now, so I haven't taken, except for a Tylenol periodically, any medication for at least 2 months now.
Good.
So the pain, it's nice to not have to take medication every single day.
Yeah. But you have some numbness in the back. Tell me about it.
I do. There's probably about a...
Do you mind to show it to us, where your incision and the numbness is? Thank you. So where's the numbness?
It's like right in this area.
That's exactly where we did the surgery. Now I'm going to show that this is still going to be fading away in the next few months, but that's where we put the cage in, and these are where we put the screws in. But you have a big scar up and down. Yeah, please have a seat. Can you tell me about that, what that scar is?
That scar was from my first fusion that I had done back in 1989.
So, do you remember that surgery?
I do remember that
surgery. Tell me about
it.
How was it?
It was very painful.
Yeah.
I had a lot of pain when I went in, so I was ready to have something done. But they split me open from the front and the back at that time.
Do you remember how long it took them to do that?
I think the surgery, gosh, I want to say it was like an 8 hours. I
8
was in
hours
surgery a long time.
Yeah, whole day.
A whole day.
Yeah.
And I was in the hospital.
That surgery still is a long surgery.
Yeah, I was in the hospital at least 5 days after surgery, and it took me a long time to recover.
And comparing to surgery you just got about 5 months ago, the OLLIF procedure, you got identical surgery. Both of them are 1-level fusion. And our surgery was 35 minutes, and we lost about 40 cc of blood.
I think I had an infusion actually done.
In the first surgery?
Yeah, I had to have a blood infusion done.
And you didn't need any blood infusion with us because you lost 1 spoon of blood. And you stayed in the hospital how long?
5 days, at least 5 days. It might have
been
For the first
surgery, yeah.
Yes.
For our surgery?
For your surgery, I went home the next day.
Next day, okay. So I'm comparing how fast did you come back, being able to do basic daily activities, that surgery and this surgery?
I don't even remember when I was able to do basic activities from the last surgery. It was a very long time though. But this surgery, much better. I actually feel almost normal now.
Yeah. Now, that surgery was a long time ago, but you got what we call OLLIF, anterior the fusion, and then they turned you and put screws in the back that they did take out a year later. So, but practically that surgery is still being done today. In 2021, we still do that surgery exactly the same way. So, my colleagues do that. I do the OLLIF procedure, obviously, and the difference is still, as you described, whole day surgery versus under an hour surgery. Unfortunately, that surgery, OLLIF, hasn't changed much in the last 30 years. And but again, that is many patients do get that kind of surgery even today, a whole day surgery. Now I'm going to turn here. This is what we did. You had a previous surgery in the 5S1. They went from the front, they put the cage in, and then they put screws in. 1 year later, they took it out. What we did was putting a cage here with that small incision and put with 4 small holes, put 4 screws here. These are the screws, and bone actually starting to grow in the front and as well in the back. So, and we didn't have to remove all that bone that they had to remove to do our surgery because they weren't in our way. We went a different path. So for their surgery, they had to remove a lot of bone there. And the way I see that is that that bone is there for a reason. If we take it off, if we remove it, then we are making it weaker. And that is what most of the time we are spending. To take that bone off, stop the bleeding, then we lose lots of blood. So overall, happy so far with the procedure?
Yes, definitely.
Well, thank you so much for the interview.